Pharmacy Technician Exam 2026 Practice Test and Study Guide 25 Must memorize questions. Question 1. Antitussive drugs are used to manage which of the following symptoms? Fever, cough, congestion, pain. Antitussives are agents specifically designed to suppress or relieve coughing. Question 2. How frequently are pharmacies required by federal law to inventory controlled substances? Every 6 months, every year, every 2 years, every 5 years. The Controlled Substances Act requires a biennial, every 2 years, inventory of all controlled substances. Question 3. Convert the ratio 1 to 5,000 to a percentage strength. 0.2%, 0.02%, 0.002%, 2%. 1/5000 equals 0.0002. To convert to a percentage, multiply by 100, 0.0002 * 100 equals 0.02%. Question 4. A prescription reads 3 GTTSOUUD X7D. What is the correct interpretation? 3 drops in the right eye as directed for 7 days. 3 drops in both eyes as directed for 7 days. 3 drops in the left eye daily for 7 days. 3 drops in each ear as directed for 7 days. 3 equals 3, GTTS equals drops, OU equals both eyes, oculoutro, UD equals as directed, X7D equals for 7 days. Question 5. Which term describes an error where a task is performed incorrectly, such as dispensing the wrong medication? Error of omission, error of commission, systemic error, near miss. An error of commission occurs when an incorrect action is taken, doing something wrong, whereas an error of omission is a failure to do something. Question 6. What is the 10-digit identifier assigned to healthcare providers for transmitting health information? DEA number, NPI number, BIN number, National Drug Code, NDC. The National Provider Identifier, NPI, is a unique 10-digit identification number issued to healthcare providers by CMS. Question 7. Which of the following is a proton pump inhibitor, PPI? Lisinopril, esomeprazole, metformin, simvastatin. Esomeprazole, Nexium, belongs to the PPI class, which reduces stomach acid production. Question 8. Metformin is primarily used to treat which condition? Hypertension, type 2 diabetes, high cholesterol, asthma. Metformin is a first-line medication for the treatment of type 2 diabetes. Question 9. What is the flat fee a patient pays to the pharmacy at the time of receiving a medication? Deductible, premium, copay, capitation. A copay is a fixed amount a patient pays for a covered healthcare service after paying the deductible. Question 10. Which regulatory body is responsible for overseeing the safety and efficacy of drugs in the United States? DEA, FDA, CMS, OSHA. The Food and Drug Administration, FDA, regulates the safety, efficacy, and security of drugs and medical devices. Question 11. A medication that is teratogenic is most dangerous to which patient population? Elderly patients, pediatric patients, pregnant women, patients with renal failure. Teratogens are substances that can cause birth defects or malformations in a developing fetus. Question 12. Which of the following is the generic name for Lipitor? Atorvastatin, rosuvastatin, simvastatin, pravastatin. Atorvastatin is the generic name for the brand name cholesterol medication Lipitor. Question 13. What is the maximum number of refills allowed for a Schedule 3/4 prescription within 6 months? 0, 1, 5, 11. Schedule 3 and 4 medications can be refilled up to 5 times within 6 months of the date the prescription was written. Question 14. The abbreviation AC on a prescription means after meals, before meals, at bedtime, twice daily. AC stands for anti-cybum, which means before meals. Question 15. Which of the following is a Schedule II controlled substance? Alprazolam, codeine with Tylenol, fentanyl, tramadol. Fentanyl is a highly potent opioid classified as Schedule II due to its high potential for abuse and dependence. Question 16. What is the primary purpose of an auxiliary label? To state the patient's name, to provide additional warnings or instructions, to list the pharmacy's phone number, to show the price of the medication. Auxiliary labels provide supplemental information such as may cause drowsiness or avoid sunlight. Question 17. Which part of the NDC number identifies the labeler or manufacturer? The first segment, the middle segment, the last segment, the entire number. The first 4 to 5 digits of the National Drug Code, NDC, represent the manufacturer/labeler code. Question 18. A tall man lettering system is used to make labels easier for tall people to read, distinguish between look-alike/sound-alike drug names, indicate high-priced medications, mark medications for pediatric use. Tall man lettering, example, glipizide versus glyburide, helps prevent medication errors involving similar drug names. Question 19. Which of the following is an example of a parenteral route of administration? Oral, sublingual, intravenous, rectal. Parenteral refers to administration by injection or infusion, bypassing the GI tract, such as for IM or SC. Question 20. What does the SIG part of a prescription represent? The drug name and strength, the patient's name and address, the directions for use, the prescriber's signature. The SIG, signatura, provides the instructions for the patient on how to take the medication.